please do it for me.
Okay, there you go.
All right, ready? Do you suffer from fatigue, lack of motivation, difficulty trying to clear a thought or process one? If you or a loved one can relate to this, it may be due to depression. You can change the way you feel inside by changing your diet. I want to share with you the knowledge I have about depression and help you turn your frown upside down. Perhaps depression used to be a topic that no one really talked about. Perhaps they were embarrassed or afraid to share their bad feelings. Instead, they felt compelled to fake a smile just to get by. We all know the old saying, fake it until you make it. Keeping bad or sad feelings bottled up inside is not healthy. Today we can address depression and help alleviate some of the possibilities as to where it may be stemming from. According to the book, Prescriptions for Natural Healing, it states that depression is a whole body illness. It affects the body in several ways. The nervous system, moods, thoughts, behaviors. It also affects the way we eat and the way we sleep. More importantly, it affects the way we feel about ourselves and how we react to different situations, and how we think about the people around us and the situations around us. We tend to lose interest in the things that we once found enjoyable and pleasurable. Symptoms of depression are chronic fatigue, sleep disturbances, whether it's excessive sleep or insomnia, changes in appetite, headaches, backaches, digestive disorders, restlessness, irritability, short temperament, and feelings of worthlessness or inadequacy. Most people often contemplate suicide. This is no way to live. Depression may be triggered by tension, stress, trauma, a chemical imbalance, thyroid disorders, hyperstimulated immune system, nutritional deficiency, poor diet, the consumption of sugar, lack of exercise, endometriosis, or allergies. In fact, one of the most common causes of depression are food allergies. Hypoglycemia is another cause of depression. It can also be hereditary. Depression affects 22% of Americans each year from the age 18 and older. Depression does not discriminate. It affects young, old, men, and women. In fact, it actually affects women twice as more common than it does men. Older adults with hardening of the arteries are more susceptible to having depression. More susceptible to have depression than older adults without a coronary disorder, according to a Dutch research. A study reported in the journal Archives of General Psychiatry suggested that there is a relationship between vascular factors such as hardening of the arteries or calcium deposits in the blood vessels and late-life depression. There are different types of depression, with variations in the number of symptoms, their severity, and persistentness. Symptoms can last for weeks, months, or years. And again, the Prescriptions for Natural Healing, it describes a couple of main types of clinical depression: major depressive disorder and bipolar disorder. In my Psychology 10th edition, it describes a depression that has to do with the changing of the seasons. It is known as SAD, or seasonal affective disorder. This depression typically happens to people during the winter time or when periods of daylight are shortened. These particular patients have feelings of sadness, feeling lethargic, drowsy, and having cravings for carbohydrates. Dr. Ellen McGrath, a former chairperson of the American Psychological Association's Task Force on Women in Depression, and author of When Feeling Bad is Good, breaks depression down into two categories: healthy depression and unhealthy depression. She defines healthy depression as a realistic feelings of pain, sadness, and disappointment, accompanied at times by guilt, anger, and or anxiety that stem from a negative experience such as trauma, loss, and unfair treatment. And a good example of this would be losing a pet or a loved one. She explains that people who are experiencing healthy depression are still able to function, just not as well as they would otherwise. Dr. Ellen McGrath also mentions that healthy depression could be taken as a signal that it's time to make some changes and take action into your life. Let's say you have gained weight. This would be a good time to start watching what you eat, becoming aware of the calories. Maybe you want to pre-plan some healthy meals and make a grocery list of meals for up to 4 days. This may help you stay on track of eating healthy and losing weight. This would be a good example of making changes and taking action into your own life. Unhealthy depression involves being unable to function in one or more areas of your life, such as relationships. Life is really a constant struggle, but with our resources and a good understanding and knowledge of handling life on life's terms, we can make it a little easier. There are countless ways to tackle depression. Caring for depression needs to be done internally and externally. Depression can be treated with a combination of things. You can seek help from a psychiatrist, be put on medication, attend group therapy sessions, find a support group, try acupuncture, or exercise. Exercising doesn't sound fun to you. Make it fun. Think about a short walk as a leisure, not just exercise. Now that I have given you some background information about what depression is, I want to share with you what has worked for me. I've taken every approach when dealing with my depression. I finally got fed up with feeling like I was a walking dead from all the medications I was on from my psychiatrist. I kept an open mind while I continued searching for ways to manage my depression. Except now I was looking for a holistic approach. I continued going to my group therapy and I weaned myself off my medication. Going to the group therapy was extremely helpful for me. But what really helped me is when I started changing my diet. I read an article online that said good nutrition helps when dealing with depression. Fruits, vegetables, and herbs can be used for fighting depression. It will also help in restoring the function of the nervous system. I jumped on this right away. I went out, I bought a juicer, I juiced for 5 to 6 days to help kickstart my body into a cleansing process that I was in dire need of from all the medication. I got amazing results from juicing. I felt better emotionally and physically. I noticed I had more energy and my skin had a nice glow. You don't have to live with depression. You can change the way you feel inside and out by changing your diet.